Hello, everybody, and welcome to another ICS podcast. I'm Shannon Wallace, and this is my ICS workshop podcast edition right before ICS 2024, which will be in Madrid this year from the 22nd of October to the 25th of October. So today I'm very excited and very lucky to actually have both the chair and the speakers for Workshop 21. Workshop 21 will be on Friday, October 25th from 9 a.m. to 10:30 a.m. And this workshop is revisiting what works and why in pelvic floor muscle exercise prescribing, a biopsychosocial integration of science to help achieve better behavioral and health outcomes. So this is a jam-packed workshop that I think will be applied to many of our ICS members, and they should get a lot out of it. With me today, I have Professor Sarah Dean, who is a professor of psychology applied to rehabilitation and health at the University of Exeter, and she is the chair of this workshop and will helping us kind of understand why they decided to put on the workshop and what this workshop entails. So I'd like to introduce her and her speakers. Thank you so much, Sarah, for joining me on our podcast today.
Thank you very much. I'm really looking forward to delivering this workshop, and we've got a great team. And I'm based at Exeter in the UK, and I've been doing quite a bit of research with this set of colleagues in the world of pelvic floor exercises. And because of my background, I'm a chartered psychologist as well as a chartered physiotherapist. So I bring together both the behavioural science and some of the physical therapy skeletons workshops. So I'm really looking forward to that. And I'd like to introduce the team. So first I'm going to go to Garcia, who's going to tell us about who she is and where she works.
So hello everyone, I'm a physiotherapist, women's health physiotherapist and researcher, currently doing my postdoc at the University of Sherbrooke in Canada, and I'm very happy to be a part of this workshop together with all the other great speakers.
Take you. And next on my list is Jean Haysmith.
Kia ora, my name is Jean Haysmith. I'm a professor of rehabilitation from Otago Waka Ihu Waka, which means University of Otago in Aotearoa, New Zealand. I'm an ex-women's health physiotherapist, and a large part of my research remains in the area of women's health, urinary incontinence and pelvic floor muscle training.
Thank you, Jean.
Hi, everybody. I'm Helena Frawley. I'm a pelvic floor clinical specialist in physiotherapy and full-time at the moment as a researcher in pelvic floor and pelvic health. I work at the University of Melbourne, and I hold a joint appointment with two women's health services. So that allows me to do very clinically based and clinical facing research at the Royal Women's Hospital and Mercy Hospital for Women in Melbourne. And I'm delighted to be part of this team, and hopefully we can unpick some of these concepts.
Thank you. And to Tori.
Hi everyone, my name is Victoria Salmon. I'm a research fellow at the University of Exeter. I'm also a chartered physiotherapist, and I have an interest in pelvic floor muscle training and urinary incontinence, and particularly in the antenatal period.
Thank you so much to everybody for joining. I think what anybody that's listening can tell is that you guys have such an expertise on this panel to really discuss this topic. So with that, I wanted to kind of ask Sarah, why did you guys decide to come up with this workshop? What was kind of the need in our ICS for a workshop like this?
Well, we've been involved in numerous projects that have included talking to women and also to non-specialist clinicians. And we found that many of them lacked the confidence to know what to do when it came to women doing their exercises, but also these clinicians not really knowing how to support women or teach women to do these exercises. So we looked at all the guidance documents and the various web-based resources, of which there are many, and saw that there's a lot of variability, and that just really added to the uncertainty about what you're meant to do. And we talked to the more specialist clinicians, and we realised that they've got very sophisticated exercise programs, and they're very clear about what they do and how they teach and what decisions they make when prescribing these exercises. And that's really great for the women they get to see. And of course, these clinicians often have some time to spend with the woman. They can do a very thorough assessment. They can supervise a progression of the exercise program and help solve barriers to exercise and so on. So they do a great job. But not all women get that opportunity. And so that means many women don't even get to start to hear about the exercises, get to start them. Others might try and then they get confused and sure they're getting it right and they don't feel they're getting anywhere and they feel like failures and they give up. And so women have told us all these things. And then the non-specialist clinicians are saying, I don't know enough about it, so I'm not going to say anything. I'm not even going to start the conversation. And the women think, oh, my clinician's really busy. I'm not going to interrupt her and I'm not going to start the conversation. So nobody talks about it. And then it becomes a really missed opportunity. We just felt if we revisited the science, with both the exercises, of which there's plenty, but also the science of exercise muscle training, looked at educational and teaching theory, we could really refresh our understanding of what it is that's really needed. What's the clear, straightforward messages that we could give women? And I think that was the start of coming together to do this workshop, because we know that for a typical patient, and I know there's no typical patient really, but the patients that come to see the specialist physios and the specialist nurse continence advisors are not all the women that could benefit from this. And so we want to consider things like population-based approaches, prevention approaches when there's only remote supervision options or when there's no option for supervision. And so we want to talk about all of those things as well. And ultimately, we want to have a set of really clear, simple, straightforward, consistent messages so that we avoid setting women up to fail. So that's really the nub of it.
I think that one of the dilemmas kind of in our field is just what you're saying. There's so many resources and literature, and sometimes it gets very confusing, especially with maybe newer practitioners who are starting out. Even, people have been doing this for a while when they go back to try to find resources, to be able to put that all together into a concise and comprehensive kind of program for their patient, and to really take their patient through kind of what that's going to look like in the long term. And so this is a really great workshop, because it kind of takes the guesswork out of going to the literature yourself, and you guys were going to present it to us in sort of a very direct and very packaged format, which is excellent. So that being said, you mentioned a lot of different topics that you're planning to cover in the workshop, so it's going to be jam-packed. So I was just wondering if you can kind of give me an overview of how the workshop's going to run, what maybe the different speakers are going to focus on, so that our ICS members can sort of be prepared when they join you for this workshop.
For sure, yeah. So we're a team of 5 that came together to prepare the workshop. But on the day, there'll be 4 of us presenting, and that will make that clear as we go through. So I'm going to start the workshop, and I'm going to obviously introduce everybody, and then we'll revisit the principles of muscle training. And I'm going to refer to what's known from sports science. And it's a general overview, and I'll actually going to use some analogies from my own experience as a track athlete. So I'm going to talk about, fast and slow twitch muscle fibers and what we need for muscle strength training. And then we're going to talk about their Cochrane review work. So I'll just hand over to them now.
So I'm Jean Haysmith. Sadly, I can't be with you in Madrid due to personal reasons. And so Gotia, who I've worked so closely with this on the review, the Cochrane review, along with 12 other fabulous people, including Helena Frawley, who will be there in Madrid as part of this workshop. And we've worked really hard over 2 years to bring together all the randomized trials we can find that look at what works best in terms of pelvic floor muscle training. We know from Chantal Dumoulin's review, Cochrane review, that pelvic floor muscle training does work. And so the question is, well, what type of pelvic floor muscle training does work best? And we actually have used all the Cochrane methods, so it's a very robust method of bringing all the data together. We've also used something called GRADE, which is a way of looking at certainty of evidence. So we can make statements that sort of say, well, this is a very high certainty finding, or this is a moderate, or this is a low or a very low certainty finding. We've gone to all the trouble of pooling data, so we have a pretty good idea of how much difference there is between different approaches to pelvic floor muscle training. And essentially, one of the things I feel about people coming to workshops is they really want to be up to date. That's one of the reasons they come. And so one of the things about a Cochrane review like this is it is the most up-to-date summary of evidence you can get. And so I'm going to hand over to Gosha, who is going to enthuse you with some of the hot questions that she's going to address in the presentation.
So as Jean has just said, we know based on high certainty evidence that pelvic floor muscle training, so the repeated voluntary pelvic floor muscle contractions and relaxations, are effective treatment for urinary incontinence. However, in physiotherapy world, and especially on social media, there are many debates on what is the best way to do the pelvic floor muscle training. So frequently, there are many conflicting opinions on how this pelvic floor muscle exercises should look. And we are discussing about the superiority of one type of pelvic floor muscle training over another. And unfortunately, many of these opinions that we may hear or see in social media are often based or not on a good understanding of really robust research, but they are mainly based on individual clinical experiences. And when research is used, there are usually results of a single small studies that catch people's attention, but not necessarily reflect the broader evidence. So there are a lot of big questions that persist. So what type of pelvic floor muscle exercises are the most effective? Should it be typical, isolated, voluntary pelvic floor muscle contractions, or should we incorporate them into some more advanced movement programs? Or maybe it is enough just to do some general exercises with no voluntary pelvic floor muscle contractions added. And what about group delivery of pelvic floor muscle training? Is it something hot or not? So we will cover all of these questions in our part of workshop.
Oh, that's great. So, I mean, it sounds like you guys are going to get really kind of broad and then start to kind of narrow in on the literature, which is for me in the audience who knows very little about this topic, it's a great way to kind of start the workshop and then kind of narrow in. So that's going to be the first sort of topic. And then who's next on the agenda?
Okay, so then it moves to Helena, and Helena's going to tell us a lot about her work in terms of her clinical work as well as her research.
Thanks, Sarah. I'll also tackle the role assessment plays in pelvic floor muscle instruction, education and training, because I believe that it's a really important component and we can't just prescribe recipes that are not based on assessment. However, as Sarah said before, a lot of the people who need pelvic floor muscle training don't have the option to attend for an assessment. So in fact, a lot of what we could do to help people may be based on no assessment findings at all. So that's the tension between what we think is probably going to inform the best program based on the pragmatics of a population level approach where the majority of people won't have that option. So I'll take two perspectives. First, the non-clinical setting, because again, looking at it from a population health approach, that will represent the majority of the population in the world. And then moving up to more of a first level of intervention or primary care level, and then the top level where you'll get more specialised approaches, and they'll be in the clinical settings. So starting from the non-clinical setting, where it may be a single episode of your opportunity might be just a one-off episode. So in that, how are you going to do any kind of assessment and then plan and teach and progress a pelvic floor muscle exercise program? We'll look at some overarching considerations to when it's that single session and what's appropriate to include, and what are some of the contextual considerations, such as the language you might use, taking into context cultural settings and backgrounds, as well as knowledge levels, health literacy, etc. And some of that brings together the science and the art of what we do. So the pelvic floor muscle training protocols, the exercise physiology, the behaviour change, a lot of that is based on science and evidence. But for the way we deliver it, a lot of that is the art of it, if you like, and needs to take into account that psychosocial. And the way that works with the bio, for example, our voluntary control of the pelvic floor muscles is, well, most of it think it's controlled by the motor control system, the voluntary motor control system. But in fact, there's the emotional motor control system as well. And the pelvic floor muscles are under the control of that emotional control system because it controls other basic bodily activities such as heart rate, respiration, etc., as well as the pelvic organs. So that's why we need to be aware of those differences between the pelvic floor muscle and other muscles. And that's why exercise prescription and the context of how we assess and teach might also need to be adjusted. So in that non-clinical setting where you might only have that single opportunity, how do you do an assessment? Obviously, if it's remote or verbal to a group, there's no opportunity to assess pelvic floor muscle function based on your clinical examination skills. So you're really relying on a very simple level of assessment and teaching, and hopefully having some opportunity for feedback so that you can tell, based on what the person tells you, what they're feeling, whether you think that's actually executing a correct contraction, and then how do you alter it if you think that doesn't sound like the person is doing a correct contraction. And that takes a fair bit of clinical experience to pick up those cues and those signals and those words and body movements, etc. So we'll look at ways and tips we can give clinicians who've got access to broad population level approaches, how they might deliver that. And then in the clinical settings, we'll look at the more refined approach of what type of assessment would you do if you have that opportunity to do a clinical assessment. Is it perineal visual observation only? Is it an internal assessment? And what you find, how does that inform your pelvic floor muscle education, exercise instruction and treatment plan and progression? So we'll try to tie all those aspects of a clinical assessment together. And hopefully in the process, do a little bit of myth busting and adjust our topic to any controversies that exist related to those topics.
Yeah, thanks, Helena, because, I mean, that last point is really part of what we want. We want to really help you to think again about how you do things and why you're doing things, and just check you haven't got some misunderstandings or myths about what works and when and why. So I will take the next slot again, which is this time more from my psychology hat and my behavioural science hat. And so we'll look at the behaviour change theory and research as a psychologist that is actually trying to help women to adhere to these exercises. So we'll look at things that are really well used in this area, like goal setting. And, you know, most people will be aware of goal setting techniques, but there's actually some strategies that you can add to goal setting that will actually enhance that attempt to promote the exercise adherence. And so we'll have a look at those, and we'll have a look at some of the less well-known behavioural change techniques and how you might be able to put them into your practice, and just sort of rehearse again some of the issues around what might be the absolutely best physiological exercise program might just be too complicated and too difficult and too advanced from a behavioural point of view for someone to even get started. And so they just give up and they don't even get going with it. So yeah, bringing together the behavioural science. And then I'll hand over to Tori, who will talk again about some different contexts and populations.
Thanks, Sarah. Yeah, so my session is really going to hopefully wrap up or pull together some of what the previous speakers have talked about in considering what these concepts mean if you're trying to start people off in different settings. So I'm really going to be focusing on some of the challenges of implementing this, all we know, in the more non-specialist settings, so in other areas of social and healthcare contexts, and really thinking about how we can use some of this to focus on widening access to this really useful and important set of principles for all women, and thinking about how these prescriptions might need to be adapted for those different contexts, for starting people off with a sort of public health, population health approach, population-based approach. How can you start people off with those simple, consistent messages that really align with that evidence and those exercise and behavioural principles, but that don't set people up to fail, as we've talked about, so they're not overcomplicated, but also they don't set the non-specialists up to fail either, because we're not expecting people outside of those specialist services to be experts in that area, but we want them to have enough confidence and really empower those other clinicians or non-clinicians to feel confident talking to women about this and getting them started, with then the ability to refer into specialist services, so knowing how to pick up when they need to pass women on, so they get a much more timely access to this assessment and tailored prescribed exercise when they need it. So I'll be drawing on some of the research we've done working in antenatal care, particularly, or in the perinatal period more broadly, with midwives and non-specialist when I say non-specialist, I mean non-pelvic health specialist roles, and how we have supported people worked with midwives to understand how they can really implement this information in their routine care, and so that women get access in a more timely manner.
Thanks, Tori. And that's really important that we are also looking at these non-specialist clinicians, but also, it's also the health workers and, even sometimes non-clinicians as well have been expressed interest in knowing what to say, how to just start talking about this topic. So that's another angle that we'll look at. But the workshop is also supported by 2 clinical case scenarios that during the workshop we'll sort of refer to those scenarios and say, what would you do now? Would you change your mind now? Would you make this a more complex exercise prescription, or would you bring it back into a more straightforward, cut down, simplified prescription? So, we just want delegates to have the opportunity to work through some typical case scenarios as we're talking. And then right at the end, we'll close with a panel. We'll all come together, and there'll be hopefully plenty of time for questions and answers and discussions about the topic.
Wow. Well, it sounds, thank you all for kind of giving a really great overview of your workshop. I think that our listeners today have a really thorough idea and a good understanding of kind of the topics that each of you tackle. And it's incredibly comprehensive. When it's very thoughtful the way that you guys have designed this workshop and kind of put together the talks in a very specific manner, going from kind of the more technical down to the more broad and then to more granular data. So as long as doing the case scenarios are always really helpful. So I think, I think this is, we've seen kind of a lot of pelvic floor workshops that have come throughout the years for ICS, but this is a very different take on it. And I think our members will really appreciate that. So with that being said, Sarah, who do you, we have a lot of members all over the world and non-members who are listening today and who are thinking about workshops that they should sign up for. So who do you think this is would be a good target audience for your guys' workshop?
Yeah, that's great. Typically we'd expect some of the specialist pelvic floor clinicians to be interested in this. And that might be a clinician or a researcher in that area. But to be quite honest, we're really open to anybody, any other clinician, any other researcher, even members of the public who have just got an interest in pelvic floor and pelvic floor exercises to both the prevention of problems with incontinence, but also the treatment or management of these problems. And so, we feel that we want to title this to anyone who's interested in pelvic floor exercises and getting these messages out there. And so we welcome all people from all backgrounds and areas of expertise.
Well, it sounds like it's going to be a jam-packed workshop. The website now is open for people to start applying for workshops. So I know once we release these podcasts, those spots usually get taken up really fast. So I suggest that everybody listening go online and sign up for ICS and sign up for this workshop right now. In the last couple minutes before we end here, any closing thoughts or comments that might be helpful to the listeners as they're kind of deciding what their ICS, 2024 agenda is going to look like in Madrid?
I don't have anything extra to add. I mean, I think our challenge is that each one of us could probably hold the whole workshop because we have a wealth of things that we would like to discuss and share with the delegates. And so, come prepared to be, wanting more, because we probably do have more to talk about than we'll ever get through in the actual workshop. But we do have resources behind us that we can signpost people to. And so we'd be very pleased to do that.
That sounds great. Well, I'm sure your question and answer session will be very robust, because I know there's a lot of people that are going to come and kind of pick your brains from all of your expertise. So thank you so much for joining me today. I just want to remind everybody that this is Workshop 21, Revisiting What Works and Why in Pelvic Floor Muscle Exercise Prescribing, a Biopsychosocial Integration of Science to help achieve better behavioral and health outcomes. And this is Workshop 21 that will be on Friday, October 25th from 9 to 10:30 a.m. As I mentioned previously, the ICS website is open for registration, so you can go on and register. And when you register, you can also sign up for these workshops. So we are very excited for you guys to kind of impart all your knowledge to us in October. And I want to thank you again for joining me. And to all of our listeners out there, it is getting very close to the time when we get to see each other in person from October 22nd to October 25th in Madrid for ICS 2024. And I'm looking so forward to seeing everybody there. Have a great day, and we'll see you soon.